Hey folks, how you doing? Must watch for if you're trying to advocate for yourself. Um, there are so many things that you need to do. People always say, "Well, I need an advocate. I need an advocate." You can advocate for yourself. Um, this is actually what I'm doing here is a child, medical records, um, X-rays, things of that nature. These are all things that need to be brought into the doctor's attention. The things that I do that can actually help. We have, well, I would say about 10,000 pieces of paper here. You're basically looking for um, x rays, EMGs, things that show nerve damage, things that show the actual injuries. We need to remind the doctor, hey, this is what I have. This is what you're treating me for. What I do is I go through and I find everything relative and necessary. Um, Here we have, in this case, without mentioning any names, um, they have a mass. They had a mass that ended up causing nerve damage, impairment, including paralysis. These are things that the doctor needs to understand. This will come forward in the chart. You're not going to attach it to the actual chart. I attach it to the outside of the chart. Very first thing that you do is always take somebody with you. I can't stress that enough. Take your mom, take your dad, take your husband, your wife, whatever. Take them with you because it's a necessity. When you do your notes, you put your notes next to what is important. Um, in this case, I will take the x-rays, I will attach them to the EMG things where it shows that they have permanent nerve damage. I will attach that to the actual findings from the x-rays, EMGs, MRIs. We want to remind the doctor this is what's wrong because he at this point is just giving you medication. He's like, okay, you're hurt. We get it. There's nothing I can do. We want to remind him about everything going on again. This will go to the front, okay? And you don't want to put too many things out there because he's not going to thumb through it all, okay? And sometimes he won't even thumb through what you have. I mean, it's kind of a hit or miss thing. Um, I keep another folder um, like this in there, and I attach that to the front so you can see what's going on, including pictures. I actually have them take notes here where it says on this day I had this, on this day I had this, so the doctor can go day by day and see how that patient was doing for that particular month. So the doctor knows how to treat the patient. Never tell the doctor he's wrong. Never tell um, like you know more than he does because or she because that's never going to work. And the sad part is most male doctors have an ego that I'm finding. Look, the women doctors are great 90% of the time. Men doctors, more than not, you're going to find out they have an ego. They do not like to be told that they're wrong. So when you are asking or telling them to do something for you specifically, um, they're going to be like, okay, this person thinks they know more than me. Get out of my office. Okay. Um, a lot of times this person had some late things, so much in pain that they couldn't make it to their appointments. So what we do there is we document that day of what actually happened to them. This patient's trying to get back into the doctor, and I said that I would help. She had to do some cancellation policies. Their cancellation policies, be very aware of them. They say we require 24-hour notice for any appointment cancellations, rescheduling. $25 fee will be assessed. If you do not show up and make payments within the 24 hours, we require 72-hour notice of cancellation of your pain management contract. So if you are out and you cannot cancel between 24 hours, this is something that you need to do because they will toss you. You're taking away from their money in a limited space, and they only have a few to do that. So you need to make notes on what exactly happened. If you have police reports, if you have eyewitness accounts, that's the person you want to bring into the office with you as well. Keep all your stuff nice and neat when you take it in there. I always put my stuff in like a vanilla envelope with a little paper clip on it like that, so you can attach it to your file. You ask the nurse before you go in there, and they will gladly do it, especially if you have an advocate or somebody with you. You're going to find out if you don't bring somebody with you that most of the time, rather than not, you're going to get pushed off. Anyway, that's the advocating tip today. Put your x-rays, put everything up front that you want the doctor to see, and you're going to have better results than you would have if in. And remember, none of this is a guarantee. It's just advocating tips so you can advocate for yourself. You guys have a good day.